Hi there, my name's Sarah. I'm a genetic counselor here at University of Michigan, and I'll be presenting on how to place referrals for genetic counseling and testing. So I just wanted to start with an overview of the Michigan Medicine Cancer Genetics Clinic where I work. We see people for evaluation based on either a personal or family history of cancer that may have a genetic link. This includes people with hereditary colon cancer, colon polyps or polyposis, and other GI cancers. Hereditary breast and ovarian cancer, endocrine cancers such as adrenal cancers, pheochromocytomas, thyroid cancers, renal cancer, melanoma, and some rare cancers like sarcomas and even pediatric cancers. Patients can call the cancer genetics clinic themselves to self-refer, or patients can be referred by their healthcare provider through a MyChart referral, which is what I'll be covering today. There is some helpful information to gather before referring a patient for genetic counseling and testing, whether it's to the cancer genetics clinic or another genetics clinic. One main reason that we see people for is based on a known genetic condition or genetic variant in the family. And in these cases, it's helpful to know what that gene is, what that syndrome name is, and if the patient can provide any documentation to us about what that is found in the family, whether it's a family letter or a copy of a relative's genetic testing report. Any of this information can kind of help us triage these referrals and know how urgent their appointment might need to be. Another common reason we see people is for personal history of cancer, and knowing if genetic testing results will impact their current cancer treatment option, again, can kind of help us expedite these appointments if needed. If someone has a new diagnosis where these results may impact their current cancer care, these appointments are triaged a little bit differently rather than someone who maybe was diagnosed several years ago and is following with surveillance. And then for individuals who have a family history of cancer, again, it's important to just document, what cancer types were in the family, who was affected with cancer, and if any of those relatives have had genetic testing. Again, this can help decide who the patient should be scheduled with and the urgency of the appointment. So we just ask that providers try to gather as much of this information as they can during history collection with the patient. When actually placing a referral in MyChart, it's important to note that there are several genetics clinics at Michigan Medicine, and there can be a little bit of overlap between these. So for cancer genetics specifically, there is the breast and ovarian cancer clinic, or the BOCREC clinic, listed in the first bullet point here. This clinic truly sees patients for new diagnoses of breast and ovarian cancer or patients with a family history of these cancer types. The Cancer Genetics Clinic, which I covered, is kind of a catch-all clinic that sees patients for multiple different indications. This clinic is staffed by several genetic counselors, gastroenterologists, and endocrinologists, and geneticists. And so we see kind of a wider variety of cancers. And if there's any questions about where a patient should go, the genetic counselors are always reviewing these and happy to triage to the correct clinic. There's also several non-cancer indications. If you type in genetics referral in MyChart, that you'll see pop up here, and you can see kind of a screenshot of that on the bottom of the screen here. So Michigan Medicine has several non-cancer clinics that do offer genetic testing for different indications, including cardiology, ophthalmology, neurology, prenatal testing, and then the adult medical genetics clinic, which is, again, kind of a catch-all for everything else that doesn't neatly fall into one of those other referral indications. So we just ask that providers kind of exercise caution and, make sure that they're reading these different clinic names to ensure that you're truly selecting the best fit for your patient. So I wanted to walk through a couple examples of what the actual referral box looks like when someone is referred to the cancer genetics clinic here. So this is an example of someone who needs testing for a familial RET variant associated with multiple endocrine neoplasia type 2. And you'll see that the things checked here, the things highlighted here, are questions that can be filled out real time with the patient by asking a couple of questions in their history collection. And so first we want to list the primary reason for referral. This is actually a drop-down list of several gene names, genetic conditions, and cancer types. And so just select the one that you think is most appropriate for your patient's indication. In this case, they're referred for a RET variant, so we would select that, as well as a secondary or alternate reason for referral. In this case, we selected thyroid cancer because the patient has a thyroid cancer history in their family. And with the free text box here, we can list which relatives have that cancer type. The secondary reason is also helpful for people who maybe have two separate reasons for referral. So maybe they have colon cancer themselves, but then a family history of breast cancer. And this allows you to denote both of those things in the referral. It also asks if the patient has a personal or family history of these things. And so in this case, the patient is coming for a family history of a genetic condition, so you would select that box. The patient does not have an active cancer diagnosis. This is a routine referral, meaning that it's not going to immediately impact, treatment options or really needs to be expedited. Generally, these are for people who have an active cancer diagnosis, these stat referrals, where it may impact their surgical decisions or chemotherapy choices. It also asks if there's been a genetic variant identified in the family. And so in this case, yes, the RET variant. And so we'll want to list out, again, what the name of that gene or syndrome is if we know that information. It also asks if the patient has had a history of a hematologic malignancy. Checking yes or no here is important because patients who have a hematologic cancer maybe need testing through a different sample type. And so this allows us to triage the patient appropriately. And then if the patient has previously had genetic counseling or testing. We also think it's helpful if you can include any summary or additional information in the comment box here. So this is a patient who has a family history of MEN2 in their mother and are interested in pursuing their own testing. That's going to look a little bit different than this example, which is a patient who has a personal history of colon cancer and needs expedited testing. So again, kind of walking through this referral, we'll select their primary reason for testing as colon cancer and personal history. If they had another cancer type or family history of cancer, you could list that under the secondary reason for referral, but it's not applicable here. The patient does have an active cancer diagnosis, so checking yes there pops up a second box that asks if the patient is currently under the care of an oncology provider at Michigan Medicine. And for this example, yes, they are. This patient needs stat testing, and so that again pops up kind of a second box to provide a reason why this testing should be expedited. In this case, it could be surgical decision making or therapy decisions. Another common reason for this is if the patient has a poor prognosis and isn't expected to live much longer. Usually we can get patients in a little bit more quickly in those cases. And then same questions here if there's a known genetic variant in the family, hematologic malignancy, and if they've previously had genetic counseling or testing. And then again, putting as much information as possible in the comments really helps us kind of assess and triage these patients more easily. So in this case, just listing that this is a new diagnosis of colon cancer and that testing impacts surgical decisions allows us to know that this patient should be scheduled more urgently for us. The genetic counselors do triage a fair number of these referrals. And so we do read the notes and kind of take that information into account when scheduling the patients. You're always welcome to reach out to the Cancer Genetics Clinic with any additional questions on these types of referrals. Thank you.